Hi, I'm Don Nystrom, and we have a really interesting program for you today, and I hope that you stay tuned because I'm going to learn a lot, and hopefully you will too, about vaping. Vaping has been in the news a lot lately. There's certainly a lot of discussion about whether it's good or bad, and what the alternatives, how you can get help if you want to stop, and maybe some information on why you probably shouldn't even start. And we know certainly there's been some incidents of young people that have had serious health issues, lung problems, etc. So I brought along with me today a couple of young ladies who are knowledgeable about the topic, so I'm going to learn as much as you do. One of them right across from me is Meagan Pichler, who is what?
I am a health educator at Marshfield Clinic Health System, Center for Community Health Advancement. And what we do in the Center for Community Health Advancement is we focus on 4 priorities, one of being chronic disease. So vaping is very much on our radar, and we're doing a lot within the health system and within the communities to address this important topic.
Right. Awesome.
Yeah.
And my other guest is Jenna Flynn, and tell us what your position is.
Yeah, thanks for having me, Don. I coordinate the Central Wisconsin Tobacco Free Coalition, which serves Marathon, Wood, and Portage counties. And our primary role is to increase education through advocacy and providing resources to the community, and really just be a resource for all those in need related to tobacco and nicotine prevention.
And you're funded by?
The Tobacco Prevention, or State Prevention, Tobacco Prevention and Control Program. So that is through the state, the Department of Health Services.
Yeah, that's great. We all have an interest in this, but let's start right at the beginning. What is vaping from the basics?
So there's a lot of different terms for vaping, whether you've heard vaping, e-cigarettes, e-hookah, cig-a-lights, they all fall under one category known as electronic nicotine delivery systems, or ENDS. And the products, I'll just grab one here. The purpose is really to inhale whatever the user has in the product. It's different from cigarettes in that you inhale smoke when you smoke a traditional cigarette. This, you're inhaling aerosol. So a common misconception is that it's water vapor. It's not just water vapor. You're inhaling an aerosol.
I'd like to know more, and show me some of these devices, because this is all new to me.
Yes, so the one that Jenna just demonstrated is the Juul. This is probably the most common that's within the media right now. And so this is the actual device, and this is the pod, which contains the nicotine, and you just put it right in here. And this is where you inhale.
So, you know, at one time, a long time ago, I smoked a pipe. I would hang it in my mouth and, you know, and puff on it.
Yep.
Don't do that anymore, but is that what you do, or you just carry that in your pocket when you want to hit?
Carry that in your pocket. When you're ready, you just go and you take a hit. One important fact that I'd like to point out is that this pod contains about the same amount of nicotine as a pack of cigarettes. And so this is about, what, 200 puffs? So kids are going through these very quickly, very condensed amount of nicotine in this little pod right here.
Wow, you wouldn't think so.
Right.
And some of the older generation products used to have a button where you'd press the button and the what transforms the e-liquid, which is this stuff, into aerosol is the heat in the e-cigarette device.
So it has a battery.
They all have a battery. These newer products have something called auto draw, so you don't need to push a button, you don't need to wait for the battery to warm up. As soon as the pod would go in, this is containing e-liquid, same as this. Once you push the pod in here, it lights up and then it's ready to be used.
So you pull the cap off and it's ready to use. So actually the vapor, the mist goes into your lungs, correct?
Yes. So
And it's what, when this is vaporized by heat, if I understand it right. Do you have any, how many pods can you get out of something like this? Is this something that's expensive, or is it compared to, let's say it was a pack a day or a pod a day? Is that, I have no idea. Is it $5, $20?
It really depends on the product and the brand. One major challenge with e-liquids currently is that there's no regulation. The FDA is not regulating those products at this time. The companies are supposed to submit applications this spring, but that's what makes this complicated is that it says 0 milligrams of nicotine per 30 milliliters, which means there could be no nicotine in this. But doesn't that sound so confusing when I'm even saying that? You would have no idea how to do the math to figure that out.
Well, if you wanted nicotine, why would you buy one with no nicotine? It's just something to do?
Some users will put nicotine, you can buy just straight nicotine. Some users will put nicotine in the products. Others, if they are adults and they are trying to quit, I've heard that they decrease the amount of nicotine over time. However, we don't know the long-term effects of the actual products.
No, they come in flavors.
They do.
This one is
Strawberry pomegranate.
okay.
That's another thing that's not regulated right now is flavors.
There was discussion, I think some states, I don't know about Wisconsin, may do, that they were going to eliminate the sale of flavored products to young people. Is that correct?
Yes, I believe that just happened
Yeah.
in Massachusetts, perhaps. Don't quote me. But some states have taken action on that. Some cities have taken action. In Wisconsin, we have this thing called preemption where we cannot regulate flavors at the local level. It has to be a statewide change.
Well, but federally, I guess, I mean, I went on the Jewel website just for background information, and I had to identify what state I lived in before they would sell me something, which I didn't want to buy anyway. But now, the batteries themselves are, I have hearing aid, you probably did notice, but I have a little battery that goes in my hearing aid, and after a few days, you know, of use, it dies. So do you put batteries in these things? How do you?
So that's the interesting thing with the Juul, and correct me if I'm wrong, but to charge a Juul, all you have to do is put it in your computer. Is that
Yes.
correct?
Oh, really?
Yep.
Yeah, so that's where we're running into some issues within schools, because this looks just like a flash drive, right? Have you ever seen a
It
flash
does
drive?
look like a flash drive.
Yes. So what you'd do here is you would just put it in, and it would just charge, and it looks like a flash drive in your computer. But yet people are charging their own electronic nicotine devices within the schools.
So if you were a parent and you may not know that that's what they're doing.
Correct.
Yeah.
Yeah.
Well, you couldn't do that with cigarettes. You know, I come from way back where cigarettes were the thing that you had to have to be cool. You roll them up in your sleeve.
Yes.
I never liked cigarettes. They're awful, but I had to be cool, and you'd buy one that lasted like 2 months. But that would be a simpler way of doing it. That's very interesting. And there's a garment here, and I'm trying to figure out why you put your sweater on our desk. What is this?
So this is a sweatshirt that you can actually use an e-cigarette with the product. So the strings, you can put an e-cigarette in one side of the string and inhale from another side of the string. So things are just getting more advanced, and
So
the companies know what they're doing. And we've been asked the question, you know, is this meant to be secretive? I don't know. You tell me.
okay.
Companies know what they're doing, and I'll just share a fun fact. The creators of Juul, I believe they actually went to Stanford. They're very smart. They worked for Apple before they worked for Juul, and they actually have invented, before Juul, they created PAX, which is a product geared specifically towards marijuana use. So I know we won't get into that today, but
see, I mean, I could see where it'd be really easy to add something to this
Yep.
and sell it on the street.
Yep.
And I believe that happened in Wisconsin and the Milwaukee area, right?
Jenna, do we want to show them the latest product?
Yeah.
That's a smartwatch, no?
You can go ahead and show it.
so this is also an electronic nicotine delivery system. It's
No way.
shaped in a different way. But yeah, it looks, what did you say? It looked
A
like an Apple
smartwatch.
Watch. Yes.
I have a Timex, but that looks like a smartwatch.
The user would inhale just like this. And this piece comes off. This is where the e-liquid would go. And just like that, it's ready to be used. So unfortunately, this is what our school resource officers, parents, and teachers are dealing with.
Yeah, and going back to, when these first came out and people from Stanford started this, we were told, yes, this is a sensation tactic. We're going to wean people off of using cigarettes by putting out these nicotine or electronic nicotine devices for people, and that is just not the case anymore. If you look at all these things, they're directly advertising and marketing to children, and so that's what we're finding.
That's awful.
Yeah.
Do you know what chemicals can come out of this? If it's a vapor, there has to be an aerosol that makes it evaporate. I think, what is the risk other than addiction to nicotine, which is easily acquired?
So with any product not being regulated, you always run the risk of the unknown. But there has been some studies that have shown there have been chemicals in the products that are the same chemicals found in cigarettes that are linked with cancer. So that's what you are inhaling. There is one product in particular that comes to mind called diacetyl. Have you heard the term popcorn lung yet?
Yes, I have.
Vaping illness? Okay. So in popcorn companies, they used to put this flavor additive in their products called diacetyl. They noticed some of their workers were getting sick, and they attribute it to diacetyl. It's a flavoring additive. So that's what's in a lot of these products. But the bottom line is none of them are regulated. So companies can put whatever they want on labels, and most often you'll find the same ingredients that are listed in food. You won't find the dangerous chemicals that you shouldn't be putting in your body.
That's interesting. I've just picked up, by the way, the Marshfield Medical Center had some information down in the Four Seasons where
Yes.
I hang out there as a volunteer, and I picked them up, and I was amazed when I just browsed through this stuff. So if you happen to be up at the hospital, it's in the Four Seasons, and they had some of this material. I had no idea what it was or how you used it or why you use it. But from what it says on here, that in addition to the unknown risk of the what we call the vapor itself, you can have throat issues, sore throats, as I understand from reading this. It says ear, eye, and throat irritation. I think you get that from cigarettes, if I remember way back 60 years ago. In fact, I'm sure it was. So it's an inconvenience, I assume. It's irritating to wherever you're walking alongside, maybe. I don't particularly want to walk through a cloud of vapor. I don't know what it is. I don't like secondhand smoke. I don't think I would like secondhand vapor either. And I don't know if it's popular. Is it a better alternative? Is it a better alternative than smoking cigarettes? If you've never smoked either one, what's your
Glad
advice?
you brought that up, Don, because that's a question we get a lot, and I do want to address it. So there's two components of this question.
Okay.
First, there's the adult use, and then there's the youth use. So with regards to adults, there has been some research that has shown if there's a user that's already been smoking and they're switching to e-cigarettes, they could have some benefit. They need to completely quit all of those nicotine products though, and we don't know the long-term effects. So in terms of harm reduction, it could be better. However, in the instance of youth, it's the exact opposite. For youth that has never used any kind of nicotine product, they should not start any kind of e-cigarette product, and it actually affects their brain development.
Really?
So it has negative effects and increases their risk for other substance uses later on in life. So there's more research to be done, but we do know that youth who have never used a nicotine product should not be using
Now,
these.
I have in this material that I picked up from where I indicated the clinic, a medical center, it said that there is a likelihood that someone could start with vaping and then move on to cigarettes. And they said, I think they said 1 out of, I don't know, I'm not a researcher like you folks are, but it said that they were 4 times more likely to go into cigarettes if they start with vaping. So, yeah, and I could probably figure out why. I mean, it'd be more convenient, I think, just to stick cigarettes in your pocket or pack or something. But because this looks, you got to carry this and that. That's why I quit. I quit pipe smoking. You had to carry tobacco cleaners. It was a nuisance. So I can see where people might say, well, I want that nicotine. I want to get that that quote high, and they puff on these things. So that's interesting. All right. We've decided that it's a bad idea for anyone, but it's really bad for teenagers. And I assume that if it's in a household, as I was, where there's an older brother and a younger brother, older sister, whatever, that it's easily picked up. And I would think that there would be some very possible that really young people that might be junior high-ish. Is that something you've seen or heard about? It does, because I know I just saw my brother today. He said he used to stitch my cigarettes, which is fine because I did really like them anyway. But I can see where that would happen. The same with any other narcotic or marijuana or anything. If it's in the household, somebody that wants to try it out, try it out.
If it's available, kids will put it in their mouth, and yeah, we've definitely seen that.
Okay.
And I think this is a good time too, Don, if you're okay to talk about what we're seeing in Wood County in terms of high schoolers that have tried.
Tell me about that.
Yeah, so every other year, the students take what's called the Youth Risk Behavior Survey.
Risk behavior.
Yeah, so it's an online survey that our high schoolers take, and then also some middle schoolers. And so that data just came out in the past couple of months that we have here to share with you. We brought Marathon, Wood County, and Portage County data. Would you like us just go into Wood County, or?
No, I think that this program will be on YouTube, and I'm hoping that other people will watch it besides our locals.
Yeah.
So
So I will share with you. So in Marathon County, we have that 37% of high school students have ever tried vaping, which is a very alarming number. 35, so that's 1 in 3 students have tried vaping.
Really?
Correct.
Is this the junior high or the high school?
That's the high school.
That's the high school.
Yep.
Okay.
And we also have data there showing that 42% have attempted quitting. So so that's an important statistic, because we know then that it's important to have resources on hand in our high school or in our high schools, so that when students are ready to quit, we're able to help them. Now that's an interesting issue all in itself, because tobacco cessation programs are mainly geared towards adults right now. So this is a whole new ballgame of trying to get kids under the age of 18 weaned off of that nicotine. So the Marshfield Clinic and other health systems are actively trying to figure out the best way to effectively and safely wean kids off of nicotine. Yeah.
From your experience, the 38% that have attempted quitting, why did they decide to quit? Was it too expensive, or was their parents were on their case, or all of the above?
We can't say that for sure, because they're self-reporting, so
they can.
There's no question related to why. We only have the information to say
Because your
how much.
objective is to help them, not to pry into their lives. So.
Not necessarily. The Youth Risk Behavior Survey has limitations on how many questions can be asked for that survey, so it's delivered through the Department of Public Instruction, so they're really the ones that determine the questions that are asked.
Okay. That would be interesting, though, as to why they. I mean, we're glad that 38% that attempted. I wish there'd be a higher number, and then they could have a success ratio.
Right. And
Go ahead.
Oh, thanks. So currently, those that vape in high school, we have numbers ranging anywhere from 16 to 21%. So in Wood County, between Marathon, Wood, and Portage, Wood is actually the highest for currently vaping high school students at 21%. So that's 1 in 5 students currently vape in the Wood County high schools. Now for middle schoolers, which we're especially concerned about, very young brains that are still developing.
Yeah.
Both brains are still developing, but even younger. 5 to 10% are currently vaping between Marathon, Wood, and Portage County.
Regularly, like not just snitching from your brothers and
Yeah,
sisters.
so basically that means that they have been vaping within the last 30 days is typically what we will say around that.
If you
Yeah.
have had an experience that counts. My question, is this more prominent with by gender? Is it like guys do it because it's cool and it turns off the ladies, or vice versa, or they both do it equally? Do you have any idea? I'm sure it hasn't been studied, but what do you
That
think?
is a good question. The only
Yeah.
thing that I know right now related to use in terms of like what's going on with the vaping related illnesses at the national level is that I'm pretty sure males have more instances of the illnesses than females. But in terms of use, I think we would have to dig deeper to find out how many. I think we can get that information. I just don't know it today.
I just want, and, I have a lot of curiosity about the topic, but like, do they start because their friends do it, and they want to be cool? They want to be part of the, the group and whatever, and they all get together, sit on the deck and take their hits.
Yeah, that does raise a good point, though, that, this epidemic that we're in really does not discriminate. Every stereotype you can think of in a school, everyone's doing it. It's not just the jocks or, I don't know. I don't know all the
I wonder,
groups, but
there have, because you work with the schools, have they had experiences where children, I'm calling them students, vape in the restroom?
yeah, they're finding that quite often.
That's what we used to do with cigarettes.
Yeah, so I've talked to the school resource officer at the Marshfield High School, and that's where we get some of these products from, actually, because he's been confiscating a lot of items, especially in the bathrooms, like you said. And it's important to note that, he can't handle this on his own. It's going to take really a village within the schools to address this issue. So
They
we're
are
really
banned, though. I mean, these things
They
are
are.
banned.
Yeah.
But I can see where it's easy to slip them in.
Yeah, many of the schools have updated their policies to include electronic nicotine devices, including Marshfield High School and Columbus High School. But yeah, the issue is how you can't be everywhere at once. So.
Of course not. And can you, if I knew how to use these and wanted to, which I don't, could I walk into a retail store puffing away, or do most of them chase you out or put a sign? I mean, there's a lot of no smoking signs, parks, retail, restaurants, etc. I would not want to be in a restaurant if somebody was doing this. Is that something that you've noticed? I've never seen anybody vaping in a retail. Have you?
So it depends on the municipality. It depends on the retailer policy as well. So like the city of Marshfield, for example, did update their clean indoor air ordinance some years back to include e-cigarettes, which means users could not use the devices in indoor areas, such as, just like they would when they disallowed cigarettes in indoor spaces. But a different example, like the city of Stevens Point, for example, they do not have their ordinance updated. The city of Wausau does. So that's something that actually can be done locally in the state of Wisconsin, is updating those ordinances to include e-cigarettes.
Okay. I have, just before I came down, one of my grandchildren just came back from college, as a lot of them are doing, and I asked him, is there any vaping? No, he's at Madison. Is there any vaping? Dumb question. He says, yes. He says, but not indoors, and none of his friends do. He says, but there is a lot of it, but mostly it's outside. I don't know if that's a rule. I mean, when you have college kids, it's hard to enforce things like you could in a primary school or high school. But he said it is common, but the group that he's part of isn't. None of them do it, and they share a dorm or an exterior apartment, but they make sure they're not associating with somebody else because they don't want to do it, and they don't want secondhand vapor, just like you don't want secondhand smoke. So before we get into what we can do as a community and for the individuals who are vaping, the quitting part, but is there something else that you'd like to address before we get into that? Otherwise, we could take a little break. Anything else you'd like to add into what we've already supplement what we've already talked about?
I just want to bring to light a program that we have at Marshfield Clinic. I should say a campaign. It's called Facts on Vaping, and that's a spot where people can go to get more information about, what is an e-cigarette, and then what you can do, which I know we're going to get more into later on. But if people are interested in learning more facts on vaping, you'll likely see a lot of billboards around the Northwoods. Yeah, we actually have one right here on Central Avenue, right across from Subway and Southway, right there. And you'll see it says these are not school supplies, and because they look so much like school supplies, we're trying to educate parents that they look like it but they're not. So,
and there's a lot of variety in them. So
absolutely.
Well, I feel bad for the parents trying to keep up to date on what's out there. I know that's also the case with other types of types of, or with narcotics in general, and medications and illegal items, that they have so many ways to hide things. A drug, Wood County drug, for the name of it, but they had an exhibit of where these young people can hide products that they shouldn't.
Yes,
really.
The hidden in plain sight bedroom.
Yeah, that was at Columbus, and I went over just for my own information, and
Good.
the more I know, the more I worry about the future.
That's one thing that we try to do as a community, and
sure. Well, that's really great that not just the Marshfield Medical Campus, but other community groups and other hospitals and facilities. They all, they really are interested in keeping people from getting sick. And then having to take care of them. So there are cessation programs, and we're going to talk about that right after we take a short break. So we'll be right back. We're back again with our two guests who are Meagan Pichler, who works for the Marshfield Medical Center Community Health Initiative. Is that the correct term?
Center for Community Health Advancement.
I was pretty close.
CCHA.
All right. And Jenna Flynn, who's a health educator, works with several groups in Marathon and Wood County would be the way to describe it. We're going to start out talking about why this is popular, and a lot of it is due to marketing by the people who sell these items, which we showed you earlier in the program. The manufacturers of the products and the equipment and who knows what all. I'm looking back when we first decided to do this program about how cigarettes were marketed back when I was a teenager, and even in the 60s, my wife and I were dating, and just like this very attractive young couple that I'm holding up pictures of, this was marketing for cigarettes. And there was no warning on the bottom, and this may be hazardous to your health. There was the Marlboro guy that would try to attract us guys, and both men and women out on a date or maybe married, both smoking cigarettes, and that was really cool. By golly, I want to be cool too, and so I'm going to go out and get me some. And these are really good. They're fresher than any other menthol cigarette, and even some of the ads in these older magazines featured doctors. Doctors, well, probably pretend doctors that said, "No, these are really good. You know, they're less less harmful because they're smoother than the other products." Nothing about the health. And now let's talk about how marketing is not on the cigarette so much, but on these e-cigarettes. Let me turn it over to you folks. Show us what they're doing.
So you don't see advertisements like that for cigarettes in magazines anymore, right?
Right.
Not on billboards, not on the radio. That was banned a long time ago. Since e-cigarettes have become more popular in the last couple years, none of that has been regulated. So you hear radio advertisements, you hear commercials, you hear all kinds of ads. YouTube is out there. Social media is a whole new platform for these companies. And the major concern is that these products are flavored. 9 out of 10 Wisconsin youth would not try these products if they were not flavored. So that's a huge challenge with marketing.
Yeah.
And that's why some cities are regulating the flavored, or some areas are regulating the flavored
Correct.
products. Okay.
Correct. And there's back and forth with, you know, if we regulate flavors, if we don't have flavors, are we doing a disservice to adult users trying to attempt quitting cigarettes? The bottom line is that 9 out of 10 Wisconsin youth would not try the products if they weren't flavored.
Really?
The majority of e-cigarette users are young people. So.
Okay. Surprised.
And in Wisconsin, the products do not have to be behind the store counter. So if you go to a retailer, these products don't have to be in a locked case or behind the store counter like commercial tobacco does. So that's another concern when we're talking about youth appeal.
My goodness. Okay, now, obviously, both of you and the organizations that you're affiliated with are interested in attacking these issues and keeping the youth and adults from getting into serious health problems, either in short term or long term. So you both are involved with that. So tell our audience how you're doing that. What's the prevention and as well as the help that they can get.
Yeah, so one of the biggest grassroots efforts we have going on in Marshfield right now is MACY, which stands for the Marshfield Area Coalition for Youth, and we're both part of that. And what MACY does is, its vision is to make Marshfield the best place to live and raise a family, and we do that through youth prevention of substance abuse. And so one of our main priorities is to address this vaping here in Marshfield, and ways that we are doing that is one of our youth groups affiliated with MACY are in the schools addressing this issue with their peers. So what better way to hear stop vaping than from one of your best friends, right? So the teachers are equipped with lessons that they're delivering to their students yearly. It's called an ACP lesson that colleagues at Center for Community Health Advancement help create and deliver. We go into schools and do drug trends. We've been doing community presentations. We have one coming up in Wisconsin Rapids. We've done some through MACY here in Marshfield. And so, you know, that grassroots effort with a lot of organizations coming together to address it is really what's going to make a big impact, making sure that everybody's on the same board, educating the parents to know what to look for in their teens' bedrooms, making sure we have that education available to everybody. Another initiative that has been going on is through Marshfield Clinic. We've been giving out e-cigarette stipends, is what we're calling them, and we've been giving those out to all 35 counties and 11 tribes that we serve in the Northwoods. And so that is funding available to these coalitions or local organizations that can help address this e-cigarette problem within their own communities. I mentioned the Facts on Vaping campaign. Feel free to go to that. So it's just factsonvaping.com. You'll see the billboards around the communities in the Northwoods. And we have some PSAs available, some parenting tips, and that is a partnership with Department of Health Services, which also has the Tobacco is Changing campaign. So that's really a tagline. Tobacco is changing here in Wisconsin and in the United States. And so we want to make sure everybody's equipped to understand what that means and make sure they know the resources for quitting should someone need to. So Jenna's now going to go into what resources we have, unless I missed something about what we're doing in the communities. Do you have anything? Okay.
No, that was great. So, as Meagan mentioned, so the Central Wisconsin Tobacco Free Coalition works closely with many other partner coalitions in the Tri-County area, such as Macy, our alcohol and other drug partnerships in Marathon, Wood, and Portage counties, really to get the information out that we do have resources available. We are able to help. We have many different initiatives within our coalition, but one of the main focuses this year was obviously e-cigarette prevention, working with the school districts very closely and providing information for them that they need for their students. One main component of that effort this year is updating school policies, ensuring that e-cigarettes are included, providing resources to students, and also staff and parent presentations. So the staff and parents are informed so they can provide the resources that they need and be able to just start the conversation with kids. That's really what we're hearing from our school resource officers when, I think you would ask the question earlier, why are the students using really, we don't know for sure unless we have that conversation. And the school resource officers say they learn just as much from the students as the students learn from them in terms of why they're using. The bottom line is some of them are just stressed. It's a coping mechanism. It's a stress reliever, just like any other coping tool that we use. So our coalition is doing many different things to try to be a resource in the community and increase education.
Not being familiar with the schools in depth, but you say you meet with the students or somebody does. How does that happen? Do they have a general assembly where everybody gets in there and hopefully is not texting but listening? Is that the way they do it, or do they do it by classroom? Do they have health education classes anymore?
They do have health education classes still, and I can speak to what's going on here in Marshfield, which at the public school, they actually were able to hire a AODA coordinator, I'll call another drug awareness coordinator, who will be delivering those lessons to the students of the school. So it will be by classroom in those health classes, so more intimate, not one-on-one, but one-on-20, one-on-25, being able to have those conversations. And something that we heard within the schools is kids just really want to know the facts. They don't want to be scared straight. They want to know what is in these products and how will it affect me. So we've really heard that and listened and created a lesson that they can learn and make their own decision around these products.
I would think that peer pressure would be effective. Am I wrong? I mean, if you're hanging with a group of people and none of them vape and you start, I would think the pressure is like, when are you doing that? You know, I went to this thing and I learned that it's bad for your brain.
Right, exactly. And that's why in prevention we're trying so hard to get at the skills and building up those skills in students of really how to say no, how to have that conversation with their friends and be able to have that self-efficacy to make their own decisions.
That's cool.
Yeah.
And Jenna, there is a helpline that's funded at, I don't know, by or at the University in Madison, 24/7 helpline. Can you tell me a little bit more about that? Is, how is that run? I think there's a kind of sheet. I'll pick this up at the clinic too. WisconsinQuitline.org. Can you talk about
Yes,
that?
so the Wisconsin Tobacco Quit Line is a free resource available to anyone interested in quitting their nicotine addiction. So when I say nicotine addiction, I mean commercial tobacco and e-cigarettes. They can contact the Wisconsin Tobacco Quit Line 24/7 at any time. They are paired with a quit coach, and if they're an adult, they would receive 2 weeks of free FDA-approved medication of nicotine replacement therapy.
Cessation.
Yes,
meds.
and one thing that's interesting is that minors could actually access the Quit Line as well if they're 13 years of age or older. The only thing is they are not able to get the 2 weeks of free medication. They would have to consult with their provider if they wanted to talk about that more. But they are able to have, someone who's unbiased and willing to help them quit their addiction.
And sympathetic to their problem to the extent that I want to help you, just like
Absolutely.
any other type of counseling. Obviously well-trained people, 24/7.
Absolutely, and the number is 1-800-QUIT now.
Right, and if you go on the internet, which they all do, and you just type in wisconsinquitline.org, wisconsinquitline.org, it gives you the phone number and some more information about what to expect if you, when you get the personal information. And I think it says you can even call back, whatever, but you can find that. You can find a lot of information about what we've been talking about, the e-cigarettes and how to help yourself get out of the bad habit that could be. So, do you have anything else that you ladies would like to add? I'd be glad to sit here for as long as you'd like to talk.
I just wanted to say too that, that initial choice of attempting the products, that's a decision that students make. However, the addiction piece is a huge challenge. The school resource officers are hearing from kids, I have tried quitting and I can't. So I just want to give a plug again for the Quit Line, that this is a great resource to use. And the bottom line here is that the kids really aren't the enemy. We can't slap them with a fine, suspend them, and expect them to quit their addiction. That doesn't work in the adult world. So there are programs available, alternative to suspension programs, that we're educating on in the community. So really, with every choice, sometimes what am I looking for? You're faced with you're not grounded, but you're faced with a repercussion of that decision. However, if we can pair that with some education and knowledge for those youth, that's really gonna give us the best outcome possible.
As I was looking this material over and learning a lot in addition to what I just learned now, they said, well, if you're under 18, your brains aren't fully developed, and it can have, you can have lifelong repercussions, not be able to get through the school that you intend to go to, if you intend to go, or get a really good job, trade, or any kind of a degree. But it seems to me that not all brains develop at the same rate by age, so you could be, it's not like, oh, I turned 18 yesterday, now I can do this without any harm. I think correctly, I would guess, that if you're 19, you still could experience problems.
Yeah, and the research actually shows that it's mid-20s before your brain is fully developed. We really urge people to, wait until, 25, 26, 27 to even, we don't want anyone to try anything, but your brains are so fragile under the age of 25.
Yeah, well, I'm glad.
And you're right that, that
it's not
you
just,
don't turn 25
I get my driver's license, or I get 21 now, I can go in a bar, or it might not be to your best interest to do that. So the best advice I think we've learned is if you haven't started, don't.
Correct.
And for heaven's sake, don't do both, and try to get help before it gets too serious. And once you have a lung problem, it's not going to go away. It's not going to go away. Your lungs and your heart are very important. As long as those are working and your brains are working, you'll be okay. But it's best not to even get started. So I'd like to thank both of you for coming in. It's been very, very interesting. I hope our viewers have learned something, and if they feel they'd like to have more information, they can certainly contact the medical center or your group too. We would be glad to have you back again if something comes along that we can assist with the community education. It's a wonderful thing you're doing.
Great.
Thank you.
Thank you
Thanks
both
for having us.
Thank you for coming in.
Okay.